Hi, my name is Sirry Alang, and I'm an associate professor of Black communities and the social determinants of health at the University of Pittsburgh. I'm sharing my latest article published in the American Journal of Public Health, and the paper is a theoretical analysis of the mechanisms by which police brutality harms Black women in particular and other women of color more generally. So we started out to answer two specific questions. What is it that exposes women of color, especially Black women, to police brutality? And how do we, as public health scholars, practitioners, and policymakers, work to eliminate police brutality and its harm on Black women and its harm on other women of color? And so this figure answers the first question. Right? Women of color are harmed by at least two systems, so racism and sexism. Racism harms them like it does harm men of color, and sexism harms them like it harms white women. But there's a third system. There's a hybrid, there's an intersection of racism and sexism that harms Black women and women of color in distinct ways. So gendered racism combines the harms of racism with the harms of sexism and creates new experiences that are really unique, that harm women of color in ways that are above and beyond how racism and how sexism harm them. There are four ways by which police brutality harms women that emerge from this intersection of racism and sexism. The first is the desecration of Black womanhood. The second is the criminalization of women of color. The third is the hypersexualization of Black and brown women. And the fourth is vicarious marginalization. And I'll talk about each one of them really quickly. So the first is the desecration of Black womanhood. The first wave of incarceration of women was in the late 1800s. Black women were imprisoned alongside men because, like Black men, they were considered aggressive. White women were actually put in reformatories to be protected from quote unquote dangerous influence of Black women and of Black men. Today, the humanity of Black women is really invincible to a lot of people in society, but specifically to police officers. The general racist stereotypes about Black and brown women as angry, lazy, loud, promiscuous further desecrate Black womanhood, elevating our exposure to police brutality. Even in our most vulnerable states, we are perceived as threats. So let's pause to remember the stories of Ma'Khia Bryan, Sandra Bland, Corinne Gaines, and Pamela Turner, among others. The second mechanism is the criminalization of communities of color. Routine profiling of Latinas, of Black and Indigenous women and girls, profiling them as drug couriers, as drug purveyors, have led to many unwarranted stops and searches and arrests and detentions and even incarceration. We, alongside our families and friends, are targeted in the racist war on drugs. Take Breonna Taylor, for example. Her affiliation with her ex-boyfriend was used to criminalize and murder her in her own apartment. Tarika Wilson and her 14-month-old son were killed under similar circumstances, shot by the police during a drug raid targeting a Black man. We are also hypersexualized. Police sexual harassment and assault are also forms of police brutality. Racist assumptions that Black women and that women of color are sexually deviant, that they are aggressive, available, and promiscuous are common. This makes it easier for our bodies to be surveyed and for us to be sexually harassed and assaulted by the police, especially during searches and traffic stops. Police brutality also includes invasion of privacy, such as viewing and distributing sexually explicit photographs or videos of women and girls who are also crime victims. And then there's the tons of unnecessary body cavity searches that have been reported by women of color. So let's again pause and remember the stories of Maliantra Montanes and Shanicia Coley, among others. And finally, there's the burden of vicarious marginalization. So this means that Black women are harmed by the harms that police cause among people in their communities. Black women, for example, are typically perceived as pillars, as caregivers in their communities, caregivers to those who are incarcerated, arrested, harmed, or murdered by the police. These burdens increase stress. These burdens also take away the resources that matter for health. As survivors of loved ones who are unjustly killed by the carceral system, Black women face a rapid deterioration of their health. They face early death from the stress of fighting for justice, as well as the stress and trauma from sudden loss. For example, Erica Garner, who's the daughter of Eric Garner, who was choked to death by the police in 2014. Erica died from a heart attack at the young age of 27 after advocating for racial justice. We also remember Yolanda Carr, the mother of Atatiana Jefferson, among many other Black women harmed by the vicarious impact of police violence. So what do we do? The second question that we sought to answer was, how do we eliminate police brutality and its harms to Black women and to other women of color? Listen, nothing really exists in a vacuum. It is not only about eliminating racism, but also eliminating sexism and other forms of structural oppression that women of color face as a result of their vulnerable position of dealing with racism and sexism. I take Black women, for example. Black lesbians and Black transgender women are more likely than their heterosexual cisgender counterparts to be stopped, to be arrested, to be assaulted by the police. Impoverished Black women are more likely to experience psychological violence. They're also more likely to be neglected by the police than their peers who have financial resources. Black women, women of color, are heterogeneous. And so data on all of our experiences must be collected, must be measured, so that our exposure to police brutality and our health outcomes are understood within our specific context. Policymakers should also evaluate how the social equity costs and benefits of policies vary across our different experiences. For example, how might implementing one policy be beneficial to some of us, but not to all of us? Multiple policies are required to address the intersecting systems that shape our health. Let's say we divest as a society, we divest from carceral systems and invest in affordable housing. As an example, so we know that this can reduce exposure to police brutality among unhoused Latinas, who are, of course, a marginalized group of women who are disproportionately surveyed by the police. But we must also consider how transgender Latinas will still face housing discrimination and other forms of transphobic violence that ultimately leaves them exposed to harm and exposed to police brutality. So just like multiple intersecting systems and structures shape the health of women of color, multiple policies are required to address them. Research and policy should also center the experiences of marginalized women over the life course. In other words, we should know what we know about police brutality and the health of, say, Indigenous women from the lived experiences of Indigenous women over the course of their lives, not just at one point in time. Examining how direct police contact and vicarious exposure to police brutality during childhood, for example, or adolescence, or in adulthood, or at like specific key periods in their lives affect their health is really important. And this will make certain that policies and interventions are better responsive to their needs and how those needs vary over the life course. And then finally, we must also continue to document the benefits of whiteness through research and policy. Structural racism is about power, about systemic social, economic, and political domination. It is maintained and reproduced by people and by institutions that benefit from it. It's the same as sexism. It exists because people who benefit from it sustain it. Public health researchers must pose questions that explore how these power systems limit exposure to police brutality for some people, while simultaneously exposing others to this structural harm. So those who benefit from racism and sexism should think about how to relinquish those benefits, because those benefits are what sustain systems such as police brutality. So in the end, racist and sexist stereotypes, policies that target and criminalize Black and Brown communities, that criminalize Black and Brown women's attempt at survivorship, and that criminalize our attempt at self-protection, as well as the broader structural inequities within which we live, all intersect to expose women of color to police violence and all intersect to harm our health. Simultaneously and tragically, police brutality is also used to criminalize and punish communities of color for experiencing these social and structural inequities. So it's really important that we collect multiple sources of data and measure multiple forms of structural oppression, as well as designing interventions across systems that center life course experiences of Black women, of Indigenous women, of Latinas. These are all really important. Of course, we must decenter whiteness and eliminate racism and sexism that make police brutality alive in our society today. Thank you so much for listening.